Bienvenidos, welcome. We have simultaneous interpretation available for our Spanish-speaking participants. Community Language Cooperative has joined us as our interpreter for this event. Please select the language you'd like to participate in. You should have the most updated version of Zoom to click on the interpretation option on the right-hand corner. If you are not bilingual in English and Spanish, we ask you to please click on the interpretation icon at the bottom of the screen if you are on a computer. If you are on a phone or iPad, please click on More or the three dots to find the interpretation icon. Select the language you'd like to participate in, English or Spanish. If you have any issues with interpretation, please reach out via chat. Si usted no es bilingüe en inglés o español, le pedimos que haga clic en el icono de interpretación en la parte inferior de la pantalla. Si está en una computadora, si está en un celular o iPad, haga clic en Más o en los tres puntos para encontrar el icono de interpretación. Seleccione el idioma en el que desea participar, en inglés o español. Gracias a todos. Si tienen algunos problemas con la interpretación, por favor, mándenos un chat. Gracias a todos. Thank you.
Welcome to the Power in Knowledge and Action webinar, Colorado Latinos and COVID-19. Today's webinar is a collection and a collaboration between the Latino Community Foundation of Colorado, our partners at Latino Decisions, and the Latino Leadership Institute. And it is made possible because of generous support from our many partners. My name is Joelle Martinez, and I am the Executive Director of the Latino Leadership Institute. Our charge as an organization is to change the face of leadership by ensuring that we are all in positions of power and influence, to advocate and to lead. But our work is also aimed at changing the power paradigm. We know that we are far more powerful when we are informed, and we know we are far more influential when we are united in our efforts to move our community forward. So today, with our partners at LCFC, we are bringing together some of our national Latino experts and joining them with Colorado Latino leaders to share relevant information from both national and local perspectives. We believe that data are more than numbers. They are a collection of complex stories. Today, we have come to this space, all of us, influential in our own networks, so that we can be informed and be ready to share this data and these stories with our networks and to take action at every level. And collectively, we have the power to act, to step up, and to lead. One of our fundamental beliefs is that leadership is both our heritage and our legacy. Latinos are leading in these defining moments, and many of them are here with us today, not just as our speakers, but also in our audience. We understand that together, COVID-19 will not determine our destiny. We will. Just a few housekeeping items before we begin. First, we encourage you to please submit your questions in the Q&A function. We will compile a list of questions and share them with our presenters. Their answers will be included in the post-webinar communication email. Finally, we want this to be engaging, and we want those not in attendance today to still know what we're learning and talking about. So please share your thoughts with us and your networks through our Twitter chat at #LatinosLead. Now, we are more excited than ever to continue our collaboration with Dr. Matt Barreto and Dr. Gabriel Sanchez of Latino Decisions. Both are nationally known and renowned experts in their fields, as you can see from their impressive bios. Their work as a Latino-focused, Latino-led research group remains essential to our work leading in this moment and well into the future. And given that research is in very high demand today, we are so grateful for their time and their expertise. and I personally have been grateful for their friendship over the last several years. We will first hear from Dr. Matt Barreto, who will share information about how COVID is impacting Latinos here in Colorado. Then we will hear from Dr. Gabriel Sanchez, who will share a recent National Latino Parent Survey that highlights how Latinos are impacted by COVID and our upcoming return to school. At this time, it is my honor to transition this to Dr. Matt Barreto.
Great, thank you so much, Joelle. I'm going to go ahead and share some slides now. There we go, I think everyone can see that now. I'm Matt Barreto. I am the co-founder and managing partner over at Latino Decisions. I've also got my business partner and colleague, Gabriel Sanchez, on the line. We're both very excited to be here. And before we start, I just want to thank Joelle personally for inviting us into this collaboration. I also want to thank Catherine Archuleta for her support and friendship over the years in supporting our research and partnerships. And I see so many other names in the participant list that are friends and colleagues. So thank you all for joining us today. What I'm going to review for you are the Colorado specific findings from our second wave research that we did with Somos Community Care. I want to give a huge thank you to Henry Munoz, the co-founder and director of Somos Community Care, for allowing us to continue to include Colorado oversamples on this work. This particular survey was also in collaboration with Unidos US, and we are currently planning and deploying the third wave of our research, which will also include an additional Colorado oversample. So soon we'll be able to report back on some even newer data and share. But to start, I'll go ahead and show you what we've been finding so far. Not surprisingly, Latinos in Colorado listed the coronavirus or COVID-19 response as their top priority that they want Congress and the president to address by overwhelming margins, 63%. Beyond that, lowering the cost of healthcare and improving wages and income and unemployment were the issues that dominated. Of course, we know that those are a direct offshoot of the COVID-19 crisis. We need to increase access to healthcare, and we need to help the economy and job situation rebound. For Latinos, they have been very closely following the news about this crisis. 60% of Colorado Latino respondents said they're following it very closely, with another 26% saying somewhat closely. So this is an issue that has been impacting us, as I will demonstrate, but we are also following this issue very closely and are actively engaged in those discussions around COVID-19 in the state of Colorado. In this particular round of surveys, we also asked people about their experiences with the CARES Act and also their views moving forward with the HEROES Act. What do they want to see our government doing? As a starting point, it's important to note that many in the Latino community did not receive support from the CARES Act. In fact, in Colorado, 43% of Latino households reported after 2.5 months that they had not received any support, any stimulus check from the CARES Act. That was especially high in our first and second generation immigrant communities, where it was over 50% of households. We know that the first CARES Act that was passed was not inclusive. In fact, if somebody in your household, anyone at all, was undocumented, you were not eligible for that relief. And many people had not e-filed their taxes or had not had all of their other paperwork in order for a direct deposit, and they were either late or skipped in getting their check. Not surprisingly, 2/3 believe that the initial stimulus was not enough and more is needed. We asked people what should be done in the Congress, what should be done nationally. One of the most popular things that can be done is to expand unemployment insurance. 93% of Colorado Latinos believe that this should be included in the next bill, including 67% who say it should definitely be included. We know that this is on the front lines of the debates in the US Senate right now, and with over 90% of Colorado Latinos calling for this, it is our hope that the senators from Colorado will take heed of this and will push for that. They also want to see a bill that is inclusive. We asked whether or not undocumented immigrants who are classified as essential workers should be eligible. We asked if undocumented immigrants who pay federal income taxes should be eligible. And finally, if regardless of citizenship status, all parents with US-born US citizen children should be eligible. You may recall that first stimulus bill had an extra $500 per child, but if the parents were undocumented, they got nothing, zero. Here we find over 85% and up to 90% of Colorado Latinos agree that the next stimulus check should be inclusive of undocumented community. They also want to see expanded testing and treatment. While testing has been expanding, it's still not fully available to anyone who needs that testing. And Latinos in Colorado are very supportive of having coronavirus testing for everyone and having treatment available for everyone, regardless of their status. Sadly, we found that 1 in 4 Latinos in the state of Colorado, 24%, say that they, a family member, or a close personal friend has become ill due to coronavirus. An additional 27% said that they know someone who believes they might have the symptoms or might have been exposed, but have been unable to currently get a test. Even with expanded testing, Latinos here in the state of Colorado indicate that this continues to be a need, and we need to make that access more equitable. The financial impact of the COVID crisis has perhaps been even greater than the health impact, which has been very hard hit in Latino communities. 45% of Colorado Latinos have been furloughed or had a pay cut. 44% say they have difficulty finding just basic monthly items like food, medicine, and other household items. And over a third, 37%, say that they're having trouble paying rent or mortgage. We also found 31% have lost their job, and an additional 20% had a small-owned business that they had to shut down. The economic impact has been extreme, and there's a reason why Latinos support continued stimulus payment and care from the federal government. We then asked them to pivot and look forward. What are the things that you are now the most concerned about? Well, first of all, is that they won't be able to afford health treatments if they become sick with COVID. At 48% very concerned about this, and an additional 23% somewhat concerned. The biggest change from our wave 1 to wave 2 survey was the second item. Children are falling behind in school. Overall, it had the highest concern amount at 74%, with 46% being very concerned. In our initial survey that we did in April, while parents were concerned about this, we didn't see as high of levels of concern when distance learning was still new. But after a few months and the end of the spring school semester, this became the highest concern for Latinos, that their children are falling behind in school. You see many of the other items on there. I might lose my health insurance. I won't be able to continue making my rent or mortgage payments. Someone in my household is going to lose their job. These are all high top concerns in the Colorado Latino community. In particular, and I know Gabe is going to talk about this more with his brand new parent study, but in Colorado, we found that Latino parents have been hard hit by this pandemic. 74% worry that their kids are falling behind, as I just noted. 42% have had to act as the homeschool teacher for their child and have reported difficulty. And 1 out of 5, 19%, do not have enough equipment to accommodate. Not everyone has a loaner laptop or extra laptops around the house for their children to use. We also noted that 1 in 5 Latino entrepreneurs in Colorado have lost significant revenue or have closed their business. I know we all probably have a story about someone we know who just hasn't been able to keep up. And among them, a third were not able to access a loan under the initial PPP program. So not only have the businesses been hard hit, but they weren't able to because of either their bank or because the loans ran dry. They were not able to access those loans. Finally, let me just conclude and say what Latinos want to see going forward. Well, the first, and if we're doing any messaging about this, local hospitals, doctors, and nurses are by far the most trusted individuals when it comes to getting news and information. In particular, if we can center Hispanic and Latino hospital workers, doctors, and nurses, they are very trusted within our community. Friends and family are where people are going next for the most trusted information. The governor of Colorado is also doing pretty well at a 6.3 rating on a scale of 0 to 10. And you can see the president at the bottom, currently not trusted by Latinos in Colorado. What do Latinos want to see happen? Well, we asked whether or not a few more weeks of staying home and missing school is the price to pay, or if we need to get back to work now. You see, overwhelmingly, 74% of Latinos said, we are all in this together. If it means a few more weeks of staying home, it's a small price to pay. Only just a quarter, 26%, say this has gone on too long and we need to get back to work. So Latinos, even though they've been hit hard, are patient. When it comes to how we're going to reopen the economy, there was very strong consensus, 81%, that governors should move to reopen their businesses in their state based on recommendations. These are flipped, based on schedules that work for their state to get people back to work using a gradual, phased-in approach on the advice of scientists and experts. 81% of Latinos agreed with that. Only 19% agreed that governors should move quickly to try to reopen as quickly as possible, as instructed by President Trump. So 81% want to see that reliance on health experts and to have a gradual phased-in approach. That was the last slide. I'm going to leave you there, and I'll turn it over to my colleague Gabe now.
Excellent. Thank you, Matt. On my slide deck that hopefully will be visible here in a second. Excellent. I'd like to also thank Joelle and all of your team for putting this together. It's great to see such a wide audience. And as Matt noted, we always love collaborating with folks in Colorado. Anything we can do to be helpful, we always appreciate the opportunity to do so. I'd also like to thank our client on this Hispanic family study, Brando Puertas, who was very gracious in allowing me to share a handful of slides from their data in advance of their own national webinar they plan to do later this month. So I will not be able to share the slide deck or any of our reports or the overall top lines just yet, but I will make sure I follow up with Joelle and her team to make those available to you as soon as our client finishes up with their national work. I'll give you a little bit of an overview of our methodology. I want to spend most of my time with you going over some of the key results. You see we had a large sample of Hispanic parents or grandparents of children 18 years of age or younger. And I will stress we included grandparents because this sample indicated that roughly 9% of all Hispanic households across the country right now are having the grandparents step up and take primary oversight or care of the children. So we wanted to make sure we're inclusive with all primary caregivers, which includes a lot of grandparents at this point in time. You see, similar to all Latino Decisions studies, this was done bilingually, and we actually have a very large sample of immigrants in our parent survey to be able to cut the data and look at any potential differences. We had this done over a wide net of trying to capture folks, whether it was on landline or cell phones, as well as online. And again, you see everybody had an opportunity to take the survey in their language of choice, English or Spanish, and I'll show you some differences across our results when applicable based on language of interview. You see this was pretty recent, June 12th through June 19th, so a lot of the content that I'll share with you is obviously fresh in the minds of many Hispanic families. So first question in the survey, we essentially asked folks to tell us in their own words what the most important education issues government should address at this time. And you see there's a wide range of things on the front and center of Hispanic families' minds right now as it relates to COVID and opening back up with schools. 36% noted more information about how schools will operate. When we followed up and we asked folks, how would you like that information or how would you like communication from your teachers or your schools? Everything we tested came out across the board very high, whether that was providing information on websites, emailing it to families, making phone calls to families. Essentially any mechanism of communication was tested positively except for contacting folks at their place of employment. So any other mechanism of getting information. Yes. Oh, thank you for noting that. So with 36% of families indicating that they want more information, essentially every mechanism of getting that information out to our families tested positively, ranging from everything from putting information on websites to direct contact through text messaging, emails, basically anything other than contacting folks at their place of employment tested extremely positively. And Spanish-speaking and immigrant families were even more interested in having direct communication from schools and from teachers directly. You also see significant challenges, as Matt noted, with internet and technology. So it's not surprising to see that 26% of families indicated they need better access to the internet or technology. I'll follow up with some specifics there. And 43% of families indicating that they need help with online education, whether that's better software or information on how to use software, basically needing help even if they do have access to the net. And interestingly for us, again, this was open-ended. Folks communicate this in their own words. 1 out of every 2 Hispanic families indicated having access to quality daycare or early learning was a significant challenge and a concern. And we want to point out that in this sample, 51% of parents are essential employees themselves who are working outside of the home. So having opportunities for daycare is going to be critical. And in fact, it's one of the things that we heard most loudly in the survey as a stressor for Hispanic families across the country. We also heard that families are extremely concerned that their children are spending too much time away from school or not learning enough from online learning. So when we think about this, overwhelmingly 83% indicating that they're concerned, what we did is followed up and asked if there were any specific subjects that folks wanted to know, that they needed help with. And math was overwhelmingly the subject of greatest concern among parents. Specifically, they indicated either they had difficulty themselves understanding the content, or that was an area where their children are having the most difficulties. When we followed up and asked what would be most helpful for the school to provide in terms of support, one-on-one tutoring, whether that was done in person or virtually, was #1 on the list of things that families wanted help with, if possible, in the fall. The survey included a lot of content regarding what precautions schools should make in order to make families feel safer in the fall. I'll share with you some of the high points, those that tested most positively, in ranked order from those that had the most support. You see that families are highly supportive, almost universally so, of having classrooms extensively cleaned every day and requiring everybody, teachers, students, staff, parents even, to wear masks at all times when entering school premises. Families are also supportive of every creative option to be able to ensure that their children catch up with their studies, including staggering school days to reduce class sizes, having a mix of in-person attendance or distance learning, what a lot of school districts are referring to as the hybrid model. You see tests very well among Hispanic families across the country, including even extending the school year if necessary to help kids catch up with their studies. Again, note the backdrop is Hispanic families are extremely concerned that their children are falling behind in their schoolwork. We saw continuing distance learning only as a model, also had strong support, but this is critical, only if needed because of spikes in the virus. As Matt noted, unfortunately, we're seeing huge inequalities with Latinos facing COVID tests in terms of positive tests and unfortunately casualties. So families recognize that context, and even though they would prefer that they have their children in person in the school in the fall, they recognize if necessary, if we have to do distance learning, they even support that option. And finally, you see a sizable segment of Hispanic families support keeping their school days longer if necessary, again, to be able to make up some lost ground. As Matt noted, there's significant challenges with digital divide across our communities, and this is key for Hispanic families across the country as showed up in our poll. You've got a combination of 1 in 3 Hispanic families who do not have regular access to the internet, period, right? So doing homeschooling and distance learning obviously is extremely challenging if you don't have regular and steady access to the internet. But another sizable segment, almost 40%, indicate while they do have access to the internet, it's only available on their cell phone. So trying to utilize the learning apps, trying to do all those things that many school districts are requiring right now when you only have access to the internet on your cell phone is incredibly challenging. And even for those families who do have regular access to the internet, a sizable segment reported that their bills have gone up significantly to be able to maintain Wi-Fi for everybody in the household that needs stronger connection. And unfortunately, almost all of those folks indicated either their job or their schools were helping to pay for that added cost. When we asked folks specifically what would they like to see their schools provide to help them with distance learning in the fall if we had to go to that module or model, you see 62% indicated having a computer provided by the school because they do not have one at home. was highly supported among families. And this was a key insight for us that we didn't think about until we saw the data. Even for those families that have a laptop or were able to get access to one from their school district, many found significant challenges with the software that was required from the school, either it not being compatible with the computer that they had at home, or they not having the ability to make the software sync with their machine. So you see 77%, even if they have access to a computer at home, they still struggle with making sure that they have the software required. So I think that's something school districts can pay close attention to, make sure that there's adequate technical support to ensure that the software required actually works with the machine available for families, including those that are provided directly by the school district. Not surprisingly, given a lot of challenges Hispanic families had with distance learning in the spring, there's high anxiety about moving towards a distance model in the academic year. You see overwhelming levels of concern. And again, it's not surprising given that a lot of families had problems, whether it was with the technology or access to the internet, thinking about coming back to school in the fall, either starting in a distance learning environment or having to move to that model at some point is a high stressor for families. So I think school districts should take note of this and provide as much communication directly to families as soon as that information is available to try to alleviate some of the stress that this is causing across the nation in our Hispanic communities. And I think maybe the most alarming statistic that I'll share with you as I get ready to close out is the fear of COVID really generating significant concern among Hispanic families to the point of a sizable segment, 53% telling us in this recent survey that they're actually considering not sending their child back to school or childcare in the fall. Many folks considering different models, including homeschooling if possible. And again, that's driven by the fear of themselves or their children getting sick with the virus. And we're already seeing this anecdotally right now in the summer, with 58% of these families reporting they didn't send their children to a summer program or a camp that they ordinarily would. One thing to keep in mind is academic literature has made clear that these summer programs are vital to ensuring that children are able to keep up with the transition from summer back to school. They lose a lot of the material that they learned during the school year over the summer. So seeing so many of those folks not having access to any of those type of programs is something for us to consider as children get ready to return to school. As Matt noted in the chat, you have access to our emails. Again, I unfortunately cannot share this slide deck with you just yet, but as soon as I have the availability of doing so, I'll make sure all of you have those resources from this study. Thank you.
Thank you so much, Dr. Barreto and Dr. Sanchez. I think the data that you just shared with us really highlights the importance of us having these conversations. We want to take just a couple of moments to have you all in attendance today provide us some feedback by taking a couple of quick polls. So I'll turn it over to Marisa, who will launch those. Great. Thank you so much. Before I introduce our next speaker, I just want to do a couple of things. I want to highlight some really important data points that were shared earlier. First of all, 63% of our community is looking at a COVID response as being one of the top priorities of our leaders. Additionally, we heard about the impact that this is having in our community, specifically that nearly 1 in 4 Latinos have become ill due to COVID. 1 in 3 here in Colorado have lost their job. And nearly 60% of Colorado Latinos have either reported losing their job or suffering from a pay cut. What we want to do next with our 2 panel speakers, Veronica Crespin-Palmer and Dr. Lara, is we want them to put context to the data. It is a privilege to introduce our first panelist, Veronica Crespin-Palmer. From the moment I met Veronica, I knew she was someone extraordinary. She's a proud Coloradan. Her love for learning led to a lifetime commitment to teach, lead, and inspire others to achieve their full potential through education. As the CEO of RISE, she works alongside Black, Latinx, immigrant, and refugee parents and community members to help them become leaders and advocates for education equity in our public school system. RISE's work is centered in Aurora, the most diverse school district in the city in Colorado, with families from over 130 countries speaking over 160 different languages. I should also mention she's an alumna of the LLI and many other esteemed national fellowship programs. Veronica, welcome, and thank you for sharing your perspective on the impact COVID is having on our students, parents, and educators.
Thank you so much, Joelle, for that introduction. And thank you to Latino Decisions, Joelle and your team at the Latino Leadership Institute for really amplifying the Latino community's voice during the pandemic. And thanks to the Latino Community Foundation of Colorado, Carlos Martinez and Rachel Griego for making this incredible learning opportunity possible for all of us. And thanks to you, the participants, for joining us today. We know everybody's incredibly busy, so thank you for coming together so we can listen and learn together as a collective Latino community. So as Joelle mentioned, at RISE, we work on family engagement and community organizing for educational equity, with the theory of change that those most impacted by the inequity that exists must lead the movement for change themselves, just like Dolores Huerta and Cesar Chavez led the farm workers movement, and Dr. King and African Americans led the civil rights movement. We believe that those most impacted by educational inequity must lead, which means low-income families of color. So we support at RISE low-income families of color to lead the family-led movement for educational equity. And as Joelle mentioned, I'm a former teacher, coach, and community organizer. So when founding RISE Colorado, really found the need to create a holistic model for family engagement within education. So I'm going to be sharing the work we've been doing at RISE Colorado with our Black, Latinx, immigrant, and refugee family leaders, but really focusing on what the Latino family leaders' experience has been. And this data I'm bringing to you all today has been conducted from over 200 needs assessments that our community organizers have done since the beginning of COVID. These 200 needs assessments represent over 900 adults and children, and our community organizers to date have had over 5,000 one-on-one check-in calls to support our family leaders with connecting them to resources, essential needs, and whatever they need to not only survive, but thrive during this challenging time. So what are our Latino family leaders experiencing right now? Food insecurity. Many of our families are prioritizing paying rent, so they have a roof over their head. So many are utilizing in Aurora Public Schools the food banks, the different food distribution sites, because they are not able to put food on their tables right now and pay for rent and their other essential needs. Job loss is incredibly high in the Latino community in Aurora. Majority of our family leaders have lost their jobs or have experienced significant cuts in hours. We are seeing incredible struggles with mental health and wellness due to the anxiety, stress, and depression that families are feeling, not knowing when the pandemic will end and when they'll be able to go back to work because jobs are incredibly limited. Eviction. We're finding out that many landlords are not following the eviction moratorium and are demanding rent on time. So this is creating incredible economic hardship on our families. And there must be something done to ensure that our families are able to recover for the many years to come, because the economic hardship will impact us for many generations. Access to healthcare is Latino Decisions shared. Many of our families do not have access to healthcare, cannot afford it, or due to their immigration status are too afraid because of the public charge rule to access healthcare and the other essential needs they have. Afraid because they're not sure what will happen on their court dates and if they'll be seen as taking advantage of the system as opposed to contributing, which they're very much trying to contribute during this time. And immigration, their status. Many of our families do not qualify for stimulus or unemployment. They cannot get any federal aid or support, which makes them reliant on food banks, local direct cash services, so that they can get the basic needs to make sure that their children and they themselves have homes, food, and the essentials to really survive during this time. And within education specifically, families are having to make the impossible and heart-wrenching decision and choice of whether they should go to work and leave their children at home alone because they either cannot afford childcare or childcare is not available, or they have no trusted family or friends to leave their children with, or go to work so they could provide for their children and leave their children home, or not go to work at all and stay home and forego their income. So these are impossible decisions our Latino community is having to make right now. The digital divide is mentioned before. Wi-Fi and devices. So families have multiple children, and sometimes the schools and district can only provide 1 to 2 technology devices. And their Wi-Fi, their broadband cannot hold for multiple children to be online at the same time to do their online learning. So families are having to also make the impossible choice of which children get the technology devices at which time, how many can be online, and they're not having equitable access to learning, all the children in the family. And students are needing to get jobs and forego college to support their family. Many of our family leaders have children who are graduating from high school or ready to go on to college, but because the parents and families out of work, the children have to forego college to provide and support their family. So we're really going to be potentially missing out and losing out on the next generation of our college-educated Latino community members. And just as Latino Decisions shared, families are really afraid that their children are falling further and further behind, and that the opportunity and academic gap are only growing and growing. So some individual stories I'd like to share of what our family leaders are going through specifically is one of our family leaders, their family consists of a husband, a wife, and 4 children, 2 children in high school and 2 children in elementary school. This family, right after the quarantine happened, they were home while the husband was at work. He works in construction. His hours have been cut back significantly, but he is still able to garner some hours in work time. The mom was at home with her children because she cleans houses, and she's no longer able to clean homes due to the pandemic. So she was home with their children doing online learning with the 4 children, and people tried to break in twice. She found out later that it was gang members in the community, and she was very afraid to call the police because of her immigration status, and also afraid because of gang retaliation. She did eventually call the police, and they apprehended the gang members who tried to break in, but they were cited with the ticket and that's it. Then they came back and tried to break in again. This absolutely terrified her and her children, and they feel like they have absolutely no recourse. Again, they're afraid to call the police, and when they do, they're afraid that retaliation will come from the gang. And now her husband's coworker got COVID-19, so he is no longer able to support with construction projects. So the mom is now supporting the husband with construction projects, and they have to leave their 4 children at home alone to make sure that they can put food on the table and continue to provide for the family. They're getting tested for COVID-19 constantly because they're fearful that they could get their children sick as well. But this is what they have to do to survive during this time. And this is what our Latino community is enduring. A lot along with a lot of single moms. Within our Latino family leaders, we have quite a few single moms who are the sole providers for their family. We have one family leader who is a single mom and she has 4 children. She cleans schools and public spaces for her job. And she is terrified to contract COVID-19 because if she does, what does that mean for her children and their livelihood and her being able to provide for them? And then lastly, we have a family leader who runs her business out of her home, selling candles, running a printing service company, and she is not sure how she'll be able to work and provide for her family while also have her children at home learning online. She's really hoping that teachers will be able to successfully engage her children online because, as she shared, she cannot become a full-time teacher. She will support her children, do everything she can, but she's really hoping teachers won't just do the 30-minute lessons as before and then leave children to their own devices. And she's really worried about how will she know if her kids are on grade level? How will students be assessed? And how will she be notified about how to best support her children's learning at home while also having the support of the teachers to really collaborate and make sure her kids are getting the best education possible? So during this time, our response at RISE during the pandemic has been really thinking about Maslow's hierarchy, meeting families' most essential and basic needs of food, shelter, and other essential needs. So we at RISE have been working with an incredible Latina who's a licensed therapist to provide mental health and wellness services to our family leaders in doing group therapy. As I mentioned, families are under incredible stress. There's a lot of depression, anxiety, and fear for the future. So these group therapy sessions are really helping our Latino family leaders survive and thrive during this time. We also created a 50-page resource guide for Black, Latinx, immigrant, and refugee families to really support them with essential needs, local organizations and statewide organizations who could support them. We've been able to fundraise and distribute over $472,000 in direct cash assistance. So we launched the Rise Together Emergency Relief Fund, where we've been able to provide families with $1,000 in direct cash assistance to pay for their rents and other essential needs they have. And as I mentioned before, we've made over 5,000 one-on-one calls since March to check in on our family leaders weekly and multiple times a week to connect them to the resources and needs they have so that they know they are not alone. We are with them and we will be with them to and through the pandemic. We also launched our Next Generation Summer Youth Program, where we're working with over 100 elementary, middle school, and high school students. As it was mentioned by Latino Decisions, families either don't have access to summer school programming or are too afraid to send their children. So we at RISE responded by creating a virtual online summer program for, again, over 100 elementary, middle school, and high school students. And it's really launched our next generation work where we're going to raise up the next generation of organizers, policymakers, educators, and elected officials to really lead within education and beyond. And this Saturday, we're going to be hosting a family-led community forum. Our family leaders came up with this idea themselves where they've invited district officials. So district officials, 5 out of the 7 school board members in Aurora are coming together so families can ask questions about online learning, can ask questions about what's about to happen, what can we expect, and to really ask to collaborate and partner with the school district so that they can gather the information they need, but also be seen as the experts in their children's education. So what is my call to action to you all today? How can we really see our Latino families as architects of policy and see them as experts and leaders in their children's education? How can we work with our Latino families to create the most pressing policies needed, like the digital divide, in addressing that? How can Wi-Fi be seen as an essential need and not just a luxury? Food insecurity. How can we provide more resources to our Latino community? Because food insecurities are incredibly high during this time. Immigration reform. Our Latino community and their status, their immigration status is deeply impacting them and only heightening and deepening the divide and inequities that already exist. And how can we work to create more direct cash assistance to our Latino community and trust them that when they they know what they need to do. They know what bills they need to pay, and trust them with that direct cash assistance and create more opportunities so they can handle their needs. Again, because many of them do not qualify for stimulus or unemployment. And let's also remember that our Latino community is incredibly innovative. Our family leaders are baking goods, selling candles, running printing services out of their homes to make ends meet, doing innovative things they hadn't done before, but really stepping up to the challenge to provide for their families and community. And let's remember that our Latino families are resilient and strong, and they are ready to lead the movement for educational equity and beyond to transform our public education system. We must see our Latino families as architects of policy, because they have incredible ideas and solutions for our most pressing challenges. And this is a special time in history. We believe that out of this tragedy will come great change and triumph. And so how can we as a Latino community really come together as a collective to push for the much needed changes our community needs and deserves, and really leave our Latino children with a beautiful future and really the life they deserve and the world that we all deserve to live in. Thank you so much.
Thank you so much, Veronica. One thing I got from that is the impossible choices our community is facing, and how those choices are more difficult without this type of information and without the voice and platform that you give so many in our community through your important work. Our final panelist today is Dr. Abigail Lara. I first was introduced to her while reading an article where she was sharing that many of the patients that were coming into her care had very familiar names: Martinez, Salazar, Gonzalez. This hit home for Dr. Lara. As a daughter of immigrant parents from Mexico, she felt connected to these patients. She decided at the age of 5 that she was going to be a doctor, and she followed that career path all the way to becoming a pulmonary critical care physician. Little did she know that later on in her career, she would be on the front lines treating some of the most sick patients dealing with COVID. It is such a treat to get to hear from a frontline Latina doctor who is caring for our COVID patients and creating some of the rules, policies, and best practices for caring for these patients. Dr. Lara, thank you for taking time out of your very busy schedule to share with all of us what you're seeing on the front lines and what you would like people to know. Welcome.
Thank you so very much, Joelle, for that wonderful introduction. And thank you to listeners for taking the time out of their very busy days to listen to my story, my experiences as a lung specialist and a critical care specialist at the University of Colorado. As Joelle said, and I want to emphasize what Dr. Barreto said, absolutely, the number of patients that I saw that had names that were similar to my family's was overwhelming my very first week on in the ICU. Although COVID does affect all members of all backgrounds, it predominantly has affected the Black and the Latino community, the essential workers of the state of Colorado. What I saw in the ICUs was an amazing team of nurses, respiratory therapists, physicians, advanced practice providers, and our trainees coming together, working diligently, long hours, committed to providing the absolute best care that we could for these patients. With gratitude and thanks, I saw our housekeepers at the hospital taking care to clean our hospital so that we would decrease the transmission of this virus in the hospital to our patients, as well as to protect us, the healthcare workers, to decrease the exposure. I can share with you all, none of us who work in the hospital wanted to be anywhere else except at the bedside taking care of these patients. It is with pride that I work at the University of Colorado School of Medicine as a faculty member, and that I practice at the University of Colorado Hospital. It is with pride because the leadership of both organizations collaborated and quickly facilitated multidisciplinary committees in order to prioritize protocols, policies, and recommendations in order for us to be able to provide the best care possible for these patients. Many of these committees I served on as a leader in the Division of Pulmonary Sciences and Critical Care Medicine. Critical to the safety of all the healthcare providers was the safety and knowledge that our hospital had acquired personal protective equipment and sufficient supplies that we were able to provide the absolute best care possible for these patients. And I can share with you that the leadership, these committees, these policies allowed us to provide outstanding care. The mortality of COVID in our patients, including the Latinx community, was far below what has been reported coming out of China, Italy, and both coasts. And I attribute that not only to the amazing work of this collaborative team in the hospital, but also the organization leadership at providing these policies and consistency in practice. I'm often asked about treatments and treatments for COVID. I'm sure that everyone on this call has heard to a certain degree the varying different treatments that are available. The treatments that are specific to COVID include medications that block entry of virus into the cells, treatments that stimulate the immune system to fight the virus, and then finally treatments to try to decrease the effects of the virus on the body, along with our standard of care approaches to providing life support. All these treatments are in varying stages of randomized controlled trials to ensure effectiveness. All these treatments also are only available on the inpatient side of the hospital. There are no current treatments that have demonstrated any effectiveness in the outpatient setting. So what can we do to prevent the transmission of the disease? What can we do as individuals to prevent the contraction of the virus? And there are three aspects that I hope to impart upon the community. Number one is the use of face masks and the effective use of face masks. Cloth, paper face masks used above the nose to cover the nose and to cover the mouth when out in public is so critically important. Along with this, frequent hand washing will also decrease the risk of transmission. And when out in public, adhering to the physical distance of at minimum of 6 feet. Those three interventions that anyone can do are so key to preventing the transmission of this disease. It decreases the transmission and it decreases the burden of disease, particularly amongst the populations that are at highest risk of contracting the disease and contracting severe COVID-related diseases. And unfortunately, it is the Latinx community and the Black community that are at highest risk, because those are the communities that have decreased access to care, as you've already heard by these amazing speakers. Those that have obesity, carry a diagnosis of diabetes and hypertension and lung diseases. These are the populations that have that highest risk of disease. If we're able to decrease the transmission, not only do we decrease the risk of disease, we decrease the loss of life, but we also decrease the potential for societal and financial impacts on these populations as well. And I cannot tell you the number of times I've encouraged people to use face masks. It is so easy to put on a face mask. It's easier than putting on a seatbelt. So I would encourage everyone to use face masks. I would also ask leadership, the leadership of a house, the leadership of the community, the leadership of workplaces and organizations to continue to maintain constant vigilance and communication around best practices of prevention of this disease, and to include multimodal methodology to distribute communication out to our population and our community. As we heard, there's a digital divide in the Latinx community. We need to overcome that so that they understand, so that we can all share education and in prevention of this disease and the transmission of the disease. Consistency in message is critically important, and to follow science. The science of COVID is evolving. Our understanding of the impact of this disease, not only on the individual, but as a society as a whole, does constantly evolve, but we must trust science. And if this message of consistency can continuously be redistributed, I believe that we have the potential to decrease the overall impact of this disease. I would also ask the leaders of any organization, community, to ensure that we have personal protective equipment that is available at the state and the local level, particularly for our essential workers in the state of Colorado and in our healthcare settings, and in particular our school settings. And building upon Dr. Crispin Palmer's message, I want to empower the Latinx community as individuals, as leaders, to take on that responsibility that we all have to each other, to our families, to my patients, to our community, to wear these face masks, to hand wash, and to follow the social distancing. And with that, I will share with you a personal anecdote. As I worked in the ICU, one of the policies that our hospital had developed and recommended and we followed probably had the highest impact, I think, from an emotional standpoint on families. And that was restricting our families from being able to enter into the COVID ICUs. With that, our healthcare teams, or my ICU teams, myself, every day that we would walk into a patient room, whether or not the patients were in a medication-induced coma, we would hold their hand and we would introduce ourselves to them. And we let them know where they were, and we promised them that we would provide them the best care possible. So with that, thank you so very much for this opportunity to share my story and my experience.
Thank you very much, Dr. Lada. Really appreciate you sharing your story. Good afternoon, everyone. My name is Carlos Martinez, and I'm the President and CEO of the Latino Community Foundation of Colorado. It is my role to advance our mission to work hand in hand with our communities to create culturally responsive strategies that build influence, equity, and opportunity for all Latino Coloradans. And I think our most responsive strategy has been our Ayuda Colorado Fund. When COVID hit, we immediately got together to figure out how we can support our Latino nonprofits, our immigrant nonprofits, as well as the Latino communities. And we created the Ayuda Colorado Fund, which is our goal to raise $1.5 million between now and the end of the year to support our communities. We've already given out over $600,000, and we're looking to give out another $300,000 to $400,000 in the next week or two. We heard the data and the stories, and data is not just a number, but it is a collection of complex stories. Stories that many of you are familiar with, because those stories are families in your neighborhood, at your work, or because you or yourselves, your families may be experiencing this. I think the goal now, as we heard this information, is how do we turn that insight, this new information that we got about data and these stories, into action? Because just listening to that without taking action, we're not going to get very far. And as you heard from all of our speakers, it is a time for us to come together to really think more innovatively of how we rebuild our communities, because our communities are not going to go back to the same. And anyways, what they were before did not really work for a lot of our folks in our community. So as we look at rebuilding our communities and we take this data and we take these stories, we must know how to work together in partnership. I think one of the things that we're seeing is more people working in partnerships. So I say to all of you, figure out how you can work with other people, because we can't do this alone. If you haven't really gotten that engaged, you need to get engaged. There are many ways that you can engage with local nonprofits, your local municipalities, to figure out how we can go ahead and get engaged. Talk to your elected officials, your council members, your state rep, your state senator. Let them know that you're concerned of how COVID is affecting the Latino community and how they can go ahead and support responses to COVID and the rebuilding as well. And I think we heard a lot around education and how this is impacting children and families. And we hear that throughout Colorado, whether we're in the San Luis Valley, in Antoñito, or we're with folks out in Rifle, or hearing the stories from people out in Lamar. That educational piece is really critical, and making sure that we close that digital divide that exists. And I think there's some simple ways that people can get involved. Go talk to the principal, ask how you can go ahead and contribute computers or other things that you can go ahead and support with your communities. There's also two big things in front of us right now that we really need to take a position on. And one of them is the census. If you have not filled out your census, and it has been surprising how many folks still haven't filled it out, you need to fill that census information out. It is critical to how funds are directed to your communities. And the second is you need to register to vote, or if you aren't able to vote, you need to get other people to register to vote and make sure they vote. These inequities that have existed in our communities, a lot of them are structural. And we have to make sure that we're electing people that understand the issues of the Latino community, the issues of how we have to go ahead and rebuild, the issues of closing that digital divide, the issues of providing testing, COVID testing to our families. We need to be able to go ahead and do that, because our families are stressed right now. Our families, when you hear about the educational divide, when you hear about the healthcare, when you hear about the job losses, when you hear about the trust levels, all that impacts a family's mental health. Not just the parents, but the parents, the children, and anybody else who may be living in that household. And so we need to be able to make sure that our family's mental health, okay, is taken care of, as well as their well-being, because they will not be able to go ahead and make the right decisions, the right choices for their families as we move forward. So I really can't stress enough to all of you the importance of getting involved. And then just lastly, a couple of things. One, in closing, I was going to share with you the results of the survey. So the first question was, where will you use this information? And overwhelmingly, 79% of you all said the place of work, followed by community work, and just in your day-to-day interactions. So I ask you to really use that information. The second one is, how will you share this information? 75% of you said coworkers, 57 friends, followed by family, which is 56. Again, share that information, have discussions with folks, because it's through this knowledge that we receive today that we're able to go ahead and take action. So just in closing, I want to say thank you to Latino Decisions, to Dr. Laura, to Veronica for their work and contributions for this symposium. I also want to thank the staff of the Latino Leadership Institute and the Latino Community Foundation of Colorado for all their work in producing today's event, with special thanks to Graciela Gonzalez from LLI and Marisa Kruger from LCFC. And I want to end with a quote from Dolores Huerta. Her quote is, "Every moment is an organizing opportunity, every person a potential activist, every minute a chance to change the world." So organize around the knowledge you just gained. Being an activist is simply being engaged in the solution. Get involved. And don't wait on the sidelines. Now is the time to change our community. Muchas gracias, and have a great rest of your day.
sé si algún día tendré que vivir sin ti, ni quiero imaginarlo. Sin tu pelo regado en mi cuerpo y las mañanas donde todo me alcanza. Yo no sé sin tu miel cómo acabar la noche y soñar caramelo. No sé qué habrá después del amor que me das, este río que siento. No quiero pensar si es cosa del destino, tendrá que esperar. Voy a parar el tiempo un día de estos, mientras te beso, linda, voy a parar el tiempo, no te darás cuenta, será suave y lento. Voy a parar el tiempo un día de estos, mientras te beso, linda, voy a parar el tiempo, no te darás cuenta, será suave y lento. No, no, Dicen los que saben que es mejor estar listo, que la vida da vueltas y todo cambia.